Dementia Understand Together is a national campaign led by the HSE, supported by many partners, which aims to raise awareness of dementia and encourage us all to create communities which are inclusive of people with dementia as well as their families. Healthy Ireland at Your Library collaborates closely with this campaign, and in today's edition I'm talking with Matthew Gibb, Director of the Dementia Services Information and Development Centre in St James's Hospital, about dementia, what it is, how we can recognise it and support those affected by it. So Matthew, you're very welcome.
Thanks, Claire.
What can you tell us about dementia?
Big topic. Dementia is, it's not a diagnosis in its own right. Dementia is more of a descriptor for a number of different kind of symptoms like memory loss, attention and concentration problems, language difficulties, basic problems with thinking, dementia itself is more of an umbrella term for a number of different conditions that accompany all those different kind of symptoms.
And do we know how many people in Ireland have dementia?
We don't know exactly how many people in Ireland have dementia. There isn't a registry at this point, but we do know from European statistics that the nearest estimate we have is about 64,000 people living with dementia in Ireland. On top of that, we think there's about 500,000 people who are affected by dementia, and that would mainly be the families. So if you think about that, it's roughly about a tenth of the population of Ireland. So I think a good number of the population will have been affected by dementia in some form or another. And
that's set to increase over the next 20 years. Why is that?
Primarily to do with an ageing population, partly to do with an increase in risk factors as well. We're talking about things like diabetes, high blood pressure, high cholesterol, things like that. But the ageing population is probably the biggest factor in the increase in numbers. But hopefully, I'm hoping here that with the improvement in general health, and if people are able to follow through, as a population, follow through on basic brain health advice, then we may be able to plateau or even reduce the expected numbers.
So what are some of the symptoms then of dementia?
Well, we're thinking about things, primarily the ones that most people would recognise are things like memory loss. We can see changes in people's language. We can see changes in people's social abilities, and their general thinking patterns or thinking abilities as well can also be impaired. But memory loss is probably the primary one that people associate with memory. But you can get all sorts of different symptoms arising, some that people perhaps wouldn't expect. Sometimes we see conditions where language or behaviour is the first things that are affected as opposed to memory, and memory may not manifest itself till quite late on in the condition. So it varies from person to person. It's a very individual disease.
You mentioned dementia is an umbrella term. People might be familiar with Alzheimer's, but that's only one type. So can you mention some of the others to us under the umbrella term?
Yeah, so Alzheimer's disease would be the one that most people have heard of and would be the most common. So that accounts for somewhere between 60 and 70% of all cases of dementia. Perhaps the next most common one would be vascular dementia, and that's where we see changes in the vascular system or the blood vessels around the body. And obviously, as you get towards the extremities of the body, these blood vessels get thinner and thinner, and the brain is full of millions and millions of these really thin blood vessels, and they clog up over time perhaps and get damaged. Some people might have heard of a thing called mixed dementia, which is basically a mixture of vascular disease and Alzheimer's disease. Other conditions, perhaps less common, would be things like dementia with Lewy body, frontotemporal dementias. We see things like primary progressive aphasias, and then you're getting into perhaps more obscure and perhaps not that common conditions.
How common is early onset dementia?
Oh, pretty uncommon now. We reckon maybe possibly about 5% of all cases. So young onset dementia, is when it's affecting people under the age of 65. That's the cut-off point. Obviously, for people with that kind of younger onset, there's a whole lot of different problems that people encounter. People with younger onset dementias, because they have families, often still in employment. So obviously things like financial issues come much more to the fore with that age cohort.
And do you think there are many misconceptions about what somebody with dementia might be like?
Oh, absolutely. I mean, I think a lot of people will be probably surprised to know that somewhere between 60 and 70% of all people with dementia are living in the community and living, kind of active and engaged lives. I think there's a perception that often that people with dementia are going to automatically end up, straight away in nursing homes, and that's just not true. I work in a clinic sometimes in St James's Hospital, and one of the things that we do in there is diagnose people with dementia, and because it is primarily a disease of older age, sometimes it's very reassuring for our patients to know that once we've given that diagnosis, to know that if we were to see them back again in a year's time, we probably wouldn't see a huge amount of difference in them. Of course, there'd be disimprovements here and there, but on the whole, they'd still be out there functioning and playing an active part in their families.
So how can we better support those people who are living within the community with dementia and make sure that they stay involved and stay connected?
Sometimes it's very hard for people to do that. It kind of comes with the territory when people have a dementia. Their geographical world tends to shrink a wee bit. Their social world also tends to shrink a bit. Not quite sure why that is. It may be because people feel uncomfortable or uneasy, even in areas that they know well, or with people that they know well. Perhaps they don't want to flag up or let people see or witness their the areas they're having difficulties with. Their forgetful moments or whatever it may be. I think we just need to be more accepting. We need to have, I think nationally, we need to have a better understanding of what dementia is and how it affects people. I think, if the more knowledge we have, I think we've got a better understanding of people. And I think communities also have a big role to play. We have a lot of, sporting and cultural organisations that could open their doors and be a wee bit more understanding and a wee bit more welcoming to people with dementia and their families. It's an illness after all. We wouldn't feel that way about somebody with heart disease, yet there seems to be a kind of stigma associated with around dementia. So if we can lessen that through education campaigns or through things like the Understand Together campaign, then I think that would be very useful.
What can you tell us about the Dementia Understand Together campaign?
So Dementia Understand Together campaign is basically a support, information and awareness campaign. So we're aware that there's lots of organisations all providing dementia information and support in all sorts of different areas, whether it's in the world of services or culture, whatever it happens to be. What we're trying to do is bring all of those together under one roof and to support those 500,000 people and their families who are out there living with dementia out there in the wider community. That's its primary aim. But
it's not going to be one person or one organisation that makes the difference. How can we as a society bring around a cultural change around dementia?
Okay, a lot of this is basically around awareness, is getting people to understand what dementia is and how it affects people. That's the basic. There's lots of organisations. One of the things that the campaign does, it has at least 40 different partner organisations involved in it, and those cut across financial, retail, and sporting, the sporting worlds, and they're all trying to promote dementia in their own ways and to promote dementia awareness and to make people with dementia and their families welcome within their organisations or their businesses. That's on a macro level, and on a micro level, there's lots of initiatives going on. Lots of small, it could be individuals who just happen to run perhaps they want to start a dementia cafe or something like that, or they're doing something something small within their own community. It doesn't have to be a massive piece of work. So if we can get lots of these little things going on, we'll change the culture bit by bit.
And will people with dementia and their families play a role?
Very much so, yeah. So from my point of view, I'm the chair of the Understand Together campaign, and ever since that campaign has been up and running, we've played. People with dementia have been an active part of that steering committee, and the Dementia Carers Campaign Network have also been an active part of that committee as well since day one. On a more local level, we're seeing people with dementia who are up, giving talks or sitting in on workshops and giving their own personal perspective of what it's like to live with dementia in Ireland today.
What does it mean to be more dementia inclusive?
I think being aware of and understanding what people are going through, the changes that they're experiencing, but also how that can impact on their ability to both interact and communicate with the community at large. That I think is probably the main aspect of it.
So if there is an organisation or a community who wants to find out more, are there resources that they can access?
Absolutely, yeah. So I'd start probably at the Understand Together website, so that's understandtogether.ie. There's lots of resources on there, and there's information, there's advice, there's service finder, so you can find out what's going on in your local community. There's also there's a lot of online training available on those websites as well, and links to other online training. All of it, certainly the vast majority of it, would certainly be free to access. Other websites such as Alzheimer.ie, so that's the Alzheimer's Society of Ireland's website. That's a good place to start as well for information. People can also look at our own website, which is dementia.ie, and there's free online training on that, and there's also education. Well, there's also information booklets and other advice available there. People can also access the HSE website, which is healthpromotion.ie, and they can order booklets from there, or they can download them. And there's lots of, they could download, for example, the Understand Together toolkit, which has got lots of advice and information about how people can, develop and start their own little projects or interventions in their own communities.
What if there is somebody who is concerned about their memory, or perhaps someone close to them? Where can they seek support?
First off, they could seek support from their GP. If they're truly worried about it, they should really go to the GP. This is a medical condition. It's that would be the best starting point. There's various places that could go to from there. The GP might be able to put their mind at ease and tell them there's nothing wrong, or they could perhaps escalate it slightly and send them to perhaps a specialist clinic for investigation. Many people who turn up at memory assessment services, we can often put their minds at rest. Perhaps the dementia perhaps isn't the cause of the problem, and perhaps it's something else.
Matthew, thank you very much.
Thank you.